death that occurs during epidemics, particularly in the Kenyan context, but could be replicated in the rest of or parts of the continent. So when WHO declared COVID-19 as a pandemic in March, the sick, of course, went to hospitals to seek treatment, only to quickly realize that the National Hospital Insurance Fund was not covering every admission in every hospital. That seemed to have been a decision that was made by the authorities but wasn't communicated to every stakeholder. So that came with problems. People getting admitted or getting treated and then getting stranded for inability to pay, and others getting detained in hospitals after discharge until their relatives or social networks would pay. And in a good number of cases, dead bodies getting retained in the hospital mortuaries, awaiting the payment of bills by families or relatives or friends and other social networks. So consequently, we experienced a situation where poor people who were suspected to be having COVID-19 simply avoided tests and avoided going to hospital for fear of getting detained over any accruing bills. And this led to compromises over the pandemic. In some cases, of course, leading to death. This is taken out of press reports in Kenya, but the gentleman there is or was a medical doctor. I could place other reports on probably mothers or teachers or engineers or ordinary people from the villages, but I deliberately chose this example because he's in the medical profession. He and his wife, he got COVID while in the line of duty, teaching at the University of Nairobi, but also working in a hospital within the city, and then getting COVID. And his case got complicated because he had pre-existing conditions. Over time, over 7 months, his bills accrued to quite a huge amount. The insurance was only able to cover up to the limit, and so the remainder of 153,000 US dollars equivalent was unpaid, and then he died, left only an 8-year-old daughter, and the hospital said they would not release the body until the bill was cleared by the family, the 8-year-old daughter. And this kind of epitomized in the Kenyan medical context the plight of medical debt. And we look at it in terms of healthcare financing, a lot of colleagues have looked at that from the perspective of policy making. And there are several ways in which people finance healthcare in the country. And one way of doing it is simply by doing nothing, which is nothing. But the other way is by paying from your pocket, assuming you have the money. The other way is through social networks, which include relatives, workplace colleagues, and friends. The other way, the fourth way, which is the formal way of doing this, is through the National Hospital Insurance Fund. We call it in Kenya the NHIF. And then an arrangement with the employer is another arrangement that is quite common, where employers commit to pay after the bills have been accrued, but it is limited to a specific amount. And then lastly, a medical insurance cover, mostly elaborate, purchased from well-established insurance companies. Those who can afford this are few and sparse around. But what causes this problem of medical debt? It is not unique to Kenya. It's not certainly unique to Africa. It's a worldwide problem that is seen even in parts of the developed world. But in the Kenyan context, there is, number one, a general lack of medical insurance. The majority of the population are simply not covered by any form or any type of health insurance policy. The NHIF that I referred to earlier covers only 15% of the population, which is about 8 million people out of the total 53. And then another 4.2% of the population takes the well-organized commercial insurance policies for health. So that gives you a total of close to 20% of the population having any form of insurance at all. And then we have insufficient medical cover when the cover reaches its limit before it covers the entire sickness. And then there's poverty and unemployment. And this compromises, the situation compromises healthcare, especially during epidemics. One way in which it does that is simply by causing fear and avoidance of hospitalization. The other is when it makes or it gets hospitals themselves into debt, because hospitals, of course, procure services which in turn they pay when they earn from the patients. There is also growing mistrust between patients and health providers, including policymakers. And then there is non-compliance with health requirements by the general public, mostly caused by apathy. And then, of course, when patients get detained because of debt, that also complicates the situation. Ethical issues that arise are a few. I choose to mention 4. One is justice and fairness. The other is the problem of human dignity being grossly compromised. And then poverty and vulnerability continues. And then discrimination in the healthcare system, or a discriminatory healthcare system, is developed and sustained by this manner of operation. Just before I stop, I wish to say issues of politics and law and governance are all involved in this. And the country could do better, and other countries in Africa could follow suit. Consider universal tax-funded mechanism that ensures no one is left behind. Policies need to be revised so that practices like patient detention and the locking up of dead bodies need to be reviewed again. We need to legislate new laws, elaborate ones at that, to strengthen already elaborate constitutional provisions, which are really good in the Kenyan context. The constitutional provisions are elaborate and well-meaning, but we need laws developed out of that. And then lastly, the last one I wish to mention is the problem of medical debt needs to be opened up and discussed both at research levels and at policy-making levels so that it is, there is a honest attempt to address it appropriately. Thank you very much.